Well, we're here with Dr. Theocharides. Dr. Theocharides, answer me a question. We put a lot of attention on getting well and using modern medicine, using ancient medicine, which is currently called alternative medicine and all that stuff. What do you personally think and believe and have seen, noticed? Because I know you are basically a scientist. You're looking at things which really work. What have you seen and noticed of what spirituality and having a spiritual take and including that in getting well, how much role does that play, if any at all? Can you shed some light on it from your viewpoint?
That has a very large role, a very huge role. And I think it really comes from the fact that the biggest or the most important organ when it comes to healing is really between our ears. The whole concept of positive confession, positive attitude, that does a lot to facilitate healing or staying well. Now myself, as a Christian, I'm open to addressing spiritual needs to patients that are open to hearing them. I will offer to pray with a patient or a client, not to impose, but just to offer that. And I find, particularly before a procedure, or if I sense there's some anxiety or some worry, offering that can be very helpful and very therapeutic to the doctor-patient relationship.
Interesting. And interesting and very, it makes a lot of sense, because, when we are basically at peace with ourselves and, things do go better and, whether some people might call it, the power of positive thinking or, the power of putting your faith in the spirituality, in God's hands, whatever God that might be, obviously hasn't survived for, many thousands of years if it wouldn't have some value, right?
Well, and particularly, what I find is there could be a lot of issues of guilt, or a sense of condemnation or low self-worth. And for those patients, that are Christian, because that is my belief, I can introduce and reinforce some beliefs and just help them in those areas. For example, I remember I had a patient that wanted was very anxious, had difficulty sleeping, and was actually wanting a medication for sleep. And we had had previous discussions about her particular faith, and I had asked her some pointed questions about some past experiences, and it was apparent that for her, she was holding a lot of unforgiveness about certain past events. And I helped her to see that she should be able to release those offenses and walk with peace in spite of those past occurrences. And I was very happy to say that 3 months later I saw her and she was doing remarkably better without any medications.
Wonderful. Absolutely wonderful. And I know, so when, for instance, I know that you're dealing with pregnant women, you're after all an OBGYN. So when moms to be come to you, have you noticed that to be a good thing to offer comfort? Because a mom to be must be nervous one way or the other way. Have you tried it with have you worked with on the spiritual level with moms to be?
I address it with all those patients that are open to it. Of course, never imposing. Our motto is prayer may be offered, but is never imposed. I must say, though, that when a patient, particularly of the Christian faith, has had prayer and has appreciated it, she will often ask me before the end of the visit, or at the end of the visit, to have a prayer with her. And it definitely helps a lot of people with anxiety or worry. As a matter of fact, sometimes when I write a prescription, it's not for a drug. It's actually for a scripture that I'm instructing my patient to memorize as part of her treatment. And the nice thing about that, if that's important to that person, of course, is that there's no side effects, no complications, and it can be very effective.
Wonderful.
And it has been very effective in my experience.
Wonderful, very interesting. Definitely appreciate your candidness. I'm sure there's lots of people out there which will find comfort in, having a doctor who understands that, basically body, spirit, mind, and the triangle is most likely it's here, and that's all there is to it. And it's wonderful to see that actually there are doctors out there who include it all. I think it's wonderful, and I'm sure your patients appreciate it. Thank you very much.
Yes, thank you. You're welcome.